Everyone, I had acute and chronic pancreatitis for my research, and so there is a lot of implementation needs that need to be considered, especially for discharge planning, which includes lifestyle changes, especially because there are a lot of other um, types of deficits and necrosis that happens with pancreatitis depending on the severity of it. The more severe the long term of this disease, the more difficult it is for discharge planning because if someone does end up having renal failure from pancreatitis, for example, then they're going to be coming in quite a bit, possibly for dialysis and such like that. Or if they have respiratory issues from atelectasis or an elevated diaphragm, then you would see them coming in a lot. So you would want to prevent a lot of this so they wouldn't have to come back for readmission. Um, Also, depending what your pancreatitis is, whether it's depending from symptomatic gallstones creating obstruction or whether if it's excessive alcohol intake, we would need to definitely assess, especially if there's necrosis or hemorrhaging, because the mortality rate can go up as up to 60% if there is necrosis associated with pancreatitis. However, if the patient has acute pancreatitis, then there is a low chance of um, the disease developing to chronic if the patient does take the proper post discharge interventions. Again with lifestyle changes, ceasing alcohol use if that's was the reason for the pancreatitis, or a changing diet, lowering their fat, and also staying up with their medication and doctor visits as well, and even educating the patient on the disease, especially looking out for certain symptoms like abdominal pain, irritation from the edema, rigid abdomen, bruising around the umbilicus, and then associated nausea and vomiting, and then a lot of times respiratory dysfunction if it's not treated quickly. So we would definitely want to assess and monitor electrolyte disturbances. Pancreatic necrosis does occur with chronic, so we would also want to monitor for any infection. Other organ failure, again, we would want to watch labs for renal failure, and also white blood cell count if there's infection. And again, we would also want to administer proper pain medication and teach the patient on how to manage their pain. And then also teach their lifestyle changes that must be implemented to prevent readmission. So those are the most important things that I feel that the nurse must implement to prevent readmission of acute and chronic pancreatitis. Thank you.